The alarm clock buzzed at 5:30 a.m., just like it had every morning for the past week. Maya rolled over and stared at the ceiling of her small apartment. Today would be different, though. Today, she wasn't heading to her corner office on the 15th floor. Instead, she was about to start a job that would surprise everyone who knew her. Maya had graduated from Harvard Business School 3 years ago. Her classmates were now working at top companies, making six-figure salaries and posting pictures of their fancy offices on social media. But Maya had chosen a different path. She was about to become a cleaner at Metropolitan General Hospital. Her father had always told her something that stuck with her. If you want to truly understand a business, you need to see it from every angle. The people at the bottom often know things that the people at the top never learn. At the time, she thought it was just one of his usual life lessons. Now she was about to put it to the test. Maya pulled on her new uniform, a simple blue shirt and dark pants. She looked at herself in the mirror and barely recognized the woman staring back. Gone was the confident business executive. In her place stood someone who looked like she belonged in the background, invisible to most people. The drive to the hospital took 20 minutes through the busy morning traffic. Maya parked her modest car in the employee lot, far from the reserved spaces near the main entrance. She grabbed her lunch bag and walked toward the staff entrance, her heart beating faster with each step. The employee locker room was already busy when she arrived. Women were changing into scrubs, talking about their shifts, and complaining about difficult patients from the night before. Maya found her assigned locker and quietly put away her personal items. The name tag on her uniform simply read Maya, Environmental Services. "You must be the new girl," said a voice behind her. Maya turned to see an older woman with kind eyes and graying hair. "I'm Dorothy. I've been cleaning these floors for 15 years. Don't worry, honey. I'll show you the ropes." Dorothy's warmth was immediately comforting. As they walked through the hospital corridors, she explained the daily routine. "We start on the 3rd floor and work our way down. Each room has to be cleaned according to strict guidelines. The doctors and nurses, well, they don't usually pay much attention to us, but that doesn't mean our work isn't important." Maya nodded, taking mental notes of everything she saw. The hospital was much larger than she had imagined from her previous visits to the administrative offices. Patients filled the hallways, some in wheelchairs, others walking slowly with IV poles. Families huddled together in waiting areas, their faces showing worry and exhaustion. "The key is to be invisible," Dorothy continued as they entered the first patient room. "Move quietly, work efficiently, and don't get in anyone's way. Some of the staff can be difficult if they think you're bothering them." Maya watched carefully as Dorothy demonstrated the proper way to clean and disinfect each surface. Every detail mattered, from the way she handled the cleaning supplies to how she moved around the medical equipment. It was clear that Dorothy took pride in her work, even if others didn't notice. As the morning progressed, Maya began to understand what Dorothy meant about being invisible. Doctors walked past without making eye contact. Nurses stepped around her as if she were part of the furniture. She was just another person in a uniform, someone whose name they didn't need to know. During her lunch break, Maya sat in the small employee cafeteria. The room was divided into invisible sections. Doctors and senior staff occupied the tables near the windows. Nurses sat together in the middle section. The cleaning staff, food service workers, and other support employees gathered at tables near the back. "How's your first day going?" Dorothy asked, sitting down across from her. "It's eye-opening," Maya replied honestly. "I'm learning a lot." "You seem different from the others we usually get," Dorothy observed. "Most people take this job because they have to, not because they want to. There's something about you that doesn't quite fit." Maya chose her words carefully. "I believe every job is important. I want to understand how this place really works." Dorothy smiled. "Well, you'll certainly learn that. This hospital has been my life for 15 years. I've seen a lot of changes, not all of them good. But the patients still need us, so we keep doing our work." The afternoon brought new challenges. Maya was assigned to clean the surgical wing, where the pace was much faster and the stakes much higher. She moved carefully through the corridors, staying out of the way as medical teams rushed between operating rooms. It was here that she first encountered Dr. Peterson, the head of surgery. He was tall, commanding, and used to getting his way. As Maya emptied a trash bin near the nurses' station, she overheard him talking to a group of residents. "The problem with this hospital," he was saying, is that we're forced to work with people who don't understand the importance of what we do. Half the staff here acts like they're doing us a favor just by showing up. Maya continued her work, but she couldn't help but listen. The conversation revealed a lot about the hospital's culture. There was clearly a hierarchy, and those at the bottom were often blamed for problems they didn't create. As the day ended, Maya reflected on everything she had experienced. She had expected to learn about hospital operations, but she was also discovering something else. The way people treated each other said a lot about the organization's true values. Dorothy was right. Maya was different from other cleaning staff. But not for the reasons Dorothy might guess. Maya wasn't just learning how to clean hospital rooms. She was studying the entire organization from a perspective she had never had before. Walking to her car that evening, Maya thought about her father's words again. She was beginning to understand what he meant. The view from the bottom was very different from the view from the top. And tomorrow she would continue her education in ways her Harvard professors could never have taught her. The drive home gave her time to process everything she had seen and heard. This was just the beginning of her journey, and already she knew that her experience would change not only how she saw the hospital, but how she thought about leadership itself. Maya had always believed that good leaders needed to understand their organizations completely. Now she was learning what that really meant. It wasn't enough to read reports and attend meetings. Real understanding came from walking in the shoes of every employee, from seeing how decisions made in boardrooms affected the people who actually did the work. As she pulled into her apartment complex, Maya smiled to herself. Tomorrow would bring new lessons, new observations, and new insights. She was exactly where she needed to be, even if no one else knew it yet. 2 weeks into her new job, Maya had settled into a routine that felt both familiar and strange. She knew exactly which elevators to take, which hallways were busiest during shift changes, and which bathrooms needed extra attention. But what she was learning about the hospital's culture troubled her more each day. It started with small things. Dr. Peterson would drop his coffee stirrer on the floor right after she had mopped, not bothering to pick it up. Nurse Supervisor Linda would leave patient rooms messy on purpose, then complain loudly about the cleaning staff when Maya arrived to clean up. Some people just don't care about doing their jobs right, Linda would say to her colleagues. Making sure Maya could hear every word, Maya bit her tongue and continued working. She was here to observe and learn, not to cause trouble, but it was getting harder to stay quiet when she saw how some staff members treated not just her, but other support workers too. The real eye-opener came during a busy Tuesday morning. Maya was cleaning the emergency department when she noticed something that made her stop in her tracks. In one of the trauma rooms, there were used medical supplies scattered on the floor, supplies that should have been disposed of immediately according to safety protocols. She knew this was serious. Contaminated materials left lying around could cause infections or even worse problems. Maya looked around for the attending physician and spotted Dr. Harrison, a young resident who seemed to be in charge of the room. "Excuse me, doctor," Maya said politely, pointing to the scattered supplies. "I think these should be cleaned up right away. It looks like they might be contaminated." Dr. Harrison barely glanced at her. "Just clean it up. That's your job, isn't it? But sir, I'm not trained to handle medical waste. The safety manual says only medical staff should—" "Listen," Dr. Harrison interrupted, his voice getting louder. "I don't need cleaning staff telling me about safety protocols. Just do what you're paid to do, and leave the thinking to people who actually went to medical school." Several nurses and other doctors nearby turned to watch the exchange. Maya felt her face getting hot, but she kept her voice calm and professional. "I understand, doctor. I just wanted to make sure patient safety wasn't at risk." "Patient safety?" Dr. Harrison laughed, and a few other staff members joined in. "Since when do janitors worry about patient safety? Your job is to empty trash cans and mop floors. Everything else is above your pay grade." Maya wanted to tell him exactly how wrong he was. She wanted to explain that she probably understood patient safety protocols better than he did, having studied healthcare management extensively. Instead, she nodded quietly and walked away. But the incident stayed with her all day. It wasn't just the disrespect that bothered her. It was the dangerous attitude behind it. If medical staff wouldn't listen to safety concerns from support workers, how many problems were being ignored? That afternoon, Maya decided to pay more attention to safety issues throughout the hospital. What she discovered shocked her. In the surgical wing, she found a storage room where sterile supplies were being kept, next to cleaning chemicals. In the pediatric ward, she noticed that hand sanitizer dispensers were often empty, but no one seemed to care enough to refill them. When she tried to report these issues, she hit the same wall every time. The attitude was always the same. Cleaning staff should stick to cleaning and leave everything else to the real medical professionals. Dr. Patricia Williams was the worst of all. As the head of internal medicine, she had a reputation for being tough. But Maya was discovering that tough often meant cruel when it came to how she treated support staff. "Why is there a mop bucket in my hallway?" Dr. Williams demanded one afternoon, even though Maya was actively using it to clean patient rooms. "I'm sorry, doctor. I'll move it right away," Maya replied. "You people have no sense of professionalism," Dr. Williams continued, speaking loudly enough for everyone nearby to hear. "This is a hospital, not a warehouse. We have standards here." Maya moved the bucket, but Dr. Williams wasn't finished. "And another thing, I don't want to see any of you cleaning staff in the patient areas during visiting hours. It looks unprofessional. Families don't want to see maintenance work while they're trying to spend time with their loved ones." Dorothy, who was working nearby, tried to explain. "But doctor, we have to clean the rooms between patients. It's required by—" "Don't argue with me," Dr. Williams snapped. "Just follow orders. That's what you're here for." Maya watched this exchange with growing anger. The dismissive tone, the complete lack of respect, the assumption that support staff were too stupid to understand basic concepts. It was all becoming too much to bear. Later that day, Maya found herself in the break room with Dorothy and a few other cleaning staff members. The mood was somber. "It's getting worse," said Carlos, who had worked at the hospital for 8 years. "The doctors used to at least be polite. Now they act like we're not even human." "Dr. Williams made Janet cry yesterday," Dorothy added quietly. "Called her incompetent in front of a whole group of nurses just because she was cleaning a room during shift change." Maya listened to story after story of disrespect and humiliation. These were good people who took pride in their work, but they were being treated like they didn't matter. It wasn't just unfair, it was counterproductive. How could a hospital function well when a large portion of its workforce felt undervalued and ignored? The breaking point came at the end of Maya's second week. She was cleaning the administrative hallway, the same hallway where her father's office was located, when she overheard a conversation that made her blood boil. Dr. Peterson was talking to Dr. Williams and several other senior staff members about budget cuts. "We need to reduce costs somewhere," Dr. Peterson was saying. "I suggest we start with the support staff. Half of them probably don't even have high school diplomas. We could easily cut their hours or replace them with cheaper workers." "Agreed," Dr. Williams replied. "These people are easily replaceable. It's not like their jobs require any real skill or training. The cleaning staff especially," added Dr. Harrison, the same resident who had dismissed Maya's safety concerns. "They're just pushing mops around. We could hire anyone off the street to do that job." Maya gripped her cleaning supplies tighter, fighting the urge to march into that room and tell them exactly how wrong they were. These doctors had no idea how much skill and knowledge it took to properly clean and disinfect a hospital. They didn't understand the complex protocols, the attention to detail, or the genuine care that workers like Dorothy brought to their jobs every single day. But more than that, they had no idea who Maya really was or what she was capable of. They saw her uniform and made assumptions about her intelligence, her education, and her worth as a human being. They were about to learn how dangerous those assumptions could be. That night, Maya went home and started writing. She documented every safety violation she had witnessed, every instance of disrespect, and every problem that could have been prevented if the medical staff had been willing to listen to the people who actually knew what was happening. On the ground level, her father had been right about seeing things from every angle, but Maya was learning something he probably hadn't expected. Sometimes the view from the bottom revealed problems that could only be solved from the top. 3 weeks into her undercover mission, Maya had filled 2 notebooks with observations that would have made any hospital administrator lose sleep. But the problems she was documenting went far beyond simple rudeness or workplace hierarchy issues. She was uncovering systemic failures that put patients at real risk. The morning started like any other, with Maya arriving early to prepare her cleaning supplies. But as she made her rounds through the cardiac unit, she noticed something alarming. Room 314 had been occupied by a patient with a serious infection just 2 days ago. Now a new patient was being moved in, but Maya could see that the room hadn't been properly disinfected. She approached the charge nurse, Rebecca, who was updating patient charts at the nurse's station. "Excuse me," Maya said quietly. "I don't think room 314 was deep cleaned after the last patient left. The protocols require—" "Are you questioning our procedures?" Rebecca interrupted without looking up from her paperwork. "We've been doing this job for years. I think we know what we're doing better than you do." Maya tried again. "I understand, but the cleaning checklist shows that room wasn't signed off for the required disinfection. With the previous patient's condition—" "Listen here," Rebecca said, finally looking at Maya with obvious irritation. "Your job is to empty trash and mop floors. Our job is to take care of patients. Stay in your lane." Maya watched helplessly as the new patient was settled into the potentially contaminated room. She made detailed notes about the incident, including the time, the room number, and the nurse who had dismissed her concerns. This wasn't just about hurt feelings anymore. This was about patient safety. Later that morning, Maya discovered another troubling pattern. In the surgical supply room, she found boxes of sterile instruments that had been stored improperly. The temperature and humidity controls weren't working correctly, which could compromise the sterility of the equipment. But when she tried to report this to the surgical coordinator, she was met with the same dismissive attitude. "Do you even know what those instruments are for?" the coordinator asked condescendingly. "This is specialized medical equipment. I doubt you'd understand the requirements even if I explained them to you." Maya bit back her response. She wanted to explain that she had studied medical device regulations extensively during her healthcare management courses. Instead, she simply said, "I just noticed the environmental controls seem to be malfunctioning." "Thanks for your concern," the coordinator replied in a tone that made it clear her concern wasn't welcome. "But I think we can handle it from here." As the days passed, Maya began to see patterns that troubled her deeply. The hospital was divided into two completely separate worlds. The medical staff, doctors, nurses, and administrators, operated in one world where their opinions mattered and their concerns were taken seriously. The support staff, cleaners, food service workers, maintenance crew, existed in another world where they were expected to work invisibly and never question anything. This division wasn't just unfair, it was dangerous. Maya realized that some of the most important safety observations came from people who spent hours in every corner of the hospital. Dorothy had once mentioned seeing water damage in a wall that could indicate a serious mold problem, but no one would listen to her concerns. Carlos had noticed that emergency equipment wasn't being properly maintained, but his reports were ignored. The worst incident happened during Maya's 4th week. She was cleaning the emergency department when she witnessed a near miss that could have been deadly. A young resident named Dr. Taylor was preparing to use a defibrillator that Maya had seen, sitting in a storage area for weeks without proper maintenance checks. Maya knew the machine hadn't been tested recently because she had seen the maintenance logs. She also knew that Dorothy had mentioned hearing strange noises from that particular unit. But when Maya tried to warn Dr. Taylor, she was brushed off completely. "I don't need equipment advice from housekeeping," Dr. Taylor said dismissively. "This is medical equipment. I'm trained to use it." Maya watched in horror as Dr. Taylor prepared to use the potentially faulty defibrillator on a patient in cardiac arrest. Fortunately, another doctor intervened at the last moment and called for a different machine. But the incident showed Maya how dangerous the communication breakdown really was. That afternoon, Maya found herself having lunch with Dorothy, Carlos, and Janet, another cleaner who had worked at the hospital for 12 years. The conversation turned to their daily frustrations. "I tried to tell Dr. Peterson about the broken lock on the medication storage room," Janet said quietly. "Anyone could walk in there and take drugs. But he told me that security wasn't my concern." "Same thing happened to me last week," Carlos added. "I noticed that one of the oxygen tanks wasn't secured properly. Could have fallen and seriously hurt someone, but when I mentioned it to the nursing supervisor, she acted like I was wasting her time." Dorothy shook her head sadly. "We see everything that happens in this hospital. We're in every room, every hallway, every corner, but they treat us like we're blind and deaf." Maya listened to these stories with growing determination. These weren't uneducated people who didn't understand what they were seeing. Dorothy had raised 3 children and managed a household budget for decades, She understood responsibility and attention to detail. Carlos had served in the military and understood the importance of following safety protocols. Janet had been observing hospital operations for 12 years. She probably knew more about daily procedures than many of the newer doctors, but their insights were being completely wasted because of prejudice and assumptions about their intelligence and value. That evening, Maya decided to test something. She created 2 identical safety reports about the same equipment malfunction. One she submitted under her real name and credentials as a healthcare consultant. The other she submitted through the normal channels as Maya the cleaner. The results were exactly what she expected. The report from the healthcare consultant was immediately forwarded to the appropriate department heads and scheduled for urgent review. The report from Maya the cleaner disappeared into the hospital's bureaucracy and was never acknowledged. Maya realized that the hospital was essentially operating with one eye closed. Half of their workforce, the half that saw everything and knew where the real problems were, was being ignored. It was like trying to diagnose a patient while refusing to listen to their symptoms. Dr. Williams provided the perfect example of this willful blindness during a staff meeting that Maya overheard while cleaning nearby offices. The meeting was about improving patient satisfaction scores, and Dr. Williams was frustrated by recent complaints. Patients keep mentioning cleanliness issues and problems with room maintenance, she said irritably. I don't understand why we can't get better performance from our support staff. Maybe we need to hire a different cleaning company. Maya wanted to scream. The cleaning staff had been reporting the exact issues that patients were complaining about, but no one would listen. The problems weren't caused by poor performance. They were caused by poor communication and lack of resources. As Maya walked home that night, she realized that her undercover experiment had revealed something far more serious than she had expected. This wasn't just about workplace respect or employee morale. The hospital's culture of dismissing support staff was creating real safety risks for patients. The question now was what to do about it. Maya had enough evidence to write a comprehensive report that would shock the hospital's board of directors. But she was also learning that sometimes the most important lessons came from experiencing problems firsthand, not just reading about them in reports. She decided to continue her mission a little longer. There were still things to learn, and she had a feeling that the biggest revelations were yet to come. The crisis Maya had been dreading finally happened on a busy Thursday morning. She was cleaning the post-operative recovery area when she heard the urgent beeping of monitors and the sound of medical staff rushing into room 218. Through the partially open door, she could see doctors and nurses working frantically around a patient who was clearly in distress. Maya's heart sank as she recognized the room. It was the same surgical suite she had tried to report 3 weeks ago, the one where sterile protocols weren't being followed properly. She had documented the problems and tried multiple times to bring them to the attention of medical staff, but had been dismissed each time. Now, watching the medical team fight to save a patient who was suffering from what appeared to be a serious post-surgical infection, Maya felt sick to her stomach. This could have been prevented. She had seen the warning signs, had tried to speak up, but no one would listen to someone wearing a cleaning uniform. Dr. Peterson was leading the emergency response, barking orders at nurses and residents. His usual arrogance was replaced by genuine concern as he worked to stabilize the patient. Maya continued cleaning nearby, listening to fragments of conversation that confirmed her worst fears. How did this happen? Dr. Peterson demanded. This patient was healthy going into surgery. Post-operative infections like this don't just appear out of nowhere. We followed all the standard protocols, insisted Dr. Harrison, the same resident who had dismissed Maya's safety concerns weeks earlier. Everything was done by the book. Maya wanted to shout that everything hadn't been done by the book. She had documented numerous protocol violations in this very room. She had tried to report contaminated equipment, improper sterilization procedures, and storage problems that could lead to exactly this kind of infection. The patient was eventually stabilized and transferred to the intensive care unit, but Maya knew the next few days would be critical. She also knew that this incident would likely trigger an investigation, one that might finally expose the communication problems she had been documenting. That afternoon, Maya found herself in an unusual position. Hospital administrators were interviewing staff members about the incident, trying to understand what had gone wrong. When they reached the Environmental Services Department, Maya realized this might be her only chance to speak up about the safety issues she had observed. The interview was conducted by Dr. Jennifer Martinez, the hospital's chief quality officer, and two administrators Maya didn't recognize. They seemed surprised that a cleaner had requested to speak with them, but they agreed to listen. "I've been working in this unit for several weeks," Maya began carefully. "I've noticed some things that might be relevant to what happened today." Dr. Martinez looked skeptical but nodded for her to continue. Maya pulled out her notebook, the one where she had been documenting safety violations. "On 3 separate occasions, I observed that room 218 wasn't being properly disinfected between patients. I also noticed problems with the storage and handling of sterile instruments in the adjacent supply room." "You observed these things?" Dr. Martinez interrupted. "And you understand the significance of what you're describing?" Maya met her gaze steadily. "Yes, I do. I also tried to report these concerns to Dr. Harrison, the surgical coordinator, and 2 different charge nurses. Each time I was told that these issues weren't my concern and that I should focus on my cleaning duties." The administrators exchanged glances. Maya could see they were trying to decide whether to take her seriously. "Can you be more specific about what you observed?" one of the administrators asked. Maya opened her notebook and began reading from her detailed notes. She described specific dates, times, and incidents. She mentioned the contaminated supplies she had seen left on floors, the improper storage of sterile equipment, and the failure to follow disinfection protocols. As she spoke, she could see the administrators becoming more attentive. These weren't vague complaints. They were specific, detailed observations from someone who clearly understood what she was seeing. "Why didn't you submit a formal incident report?" Dr. Martinez asked. "I tried," Maya replied. "But I was told multiple times that safety concerns weren't my responsibility. When I persisted, I was accused of overstepping my boundaries and creating trouble." The interview lasted another 30 minutes, with Maya providing detailed information about each incident she had documented. When it was over, the administrators thanked her and promised to investigate her concerns thoroughly, but Maya's relief was short-lived. Word of her interview somehow spread quickly through the hospital, and the reaction from medical staff was swift and angry. Dr. Harrison cornered her in a supply closet later that day, his face red with fury. "How dare you try to blame medical staff for that patient's condition," he hissed. "You're just a cleaner. You have no business making accusations about medical procedures." "I wasn't making accusations," Maya replied calmly. "I was reporting safety violations that I observed." "Safety violations?" Dr. Harrison laughed bitterly. "You don't even know what real safety protocols are. You're just trying to cover up your own department's failures by pointing fingers at qualified medical professionals." Before Maya could respond, Dr. Peterson appeared in the doorway. He had obviously been looking for Dr. Harrison, but his expression darkened when he saw Maya. "What's going on here?" he demanded. "This cleaner has been spreading lies about our surgical procedures," Dr. Harrison explained. "She's trying to blame us for the patient incident instead of admitting that her own poor cleaning standards probably caused the infection." Maya felt her temper rising but forced herself to stay calm. "I documented specific protocol violations that I witnessed personally. The investigation will determine what actually happened." Dr. Peterson stepped closer, using his height to intimidate her. "Let me make something very clear," he said in a low, dangerous voice. "Your job is to clean floors and empty trash. That's it. If you continue to interfere with medical operations or spread rumors about qualified professionals, you'll find yourself looking for a new job very quickly." "Are you threatening me?" Maya asked quietly. "I'm explaining reality," Dr. Peterson replied. "You're easily replaceable. We have dozens of people who would be happy to take your position. But qualified surgeons like Dr. Harrison and myself are not so easy to replace. Think carefully about where your best interests lie." Maya stared at him for a long moment, thinking about all the incidents she had witnessed and documented. She thought about Dorothy, Carlos, and Janet. Good people who had been intimidated into silence by exactly this kind of threat. She thought about the patient in the ICU who might be fighting for their life because safety concerns had been ignored. "I understand exactly where my interests lie," Maya said finally. "They lie in making sure patients receive safe, quality care. If that threatens you, maybe you should ask yourself why." Dr. Peterson's face turned an even darker shade of red. "You have no idea who you're dealing with," he said through gritted teeth. I have connections throughout this hospital and this city. I can make your life very difficult if you continue down this path. Maya met his gaze without flinching, and you have no idea who you're dealing with either. The confrontation was interrupted by Dorothy, who appeared in the hallway looking worried. Maya, there you are, she said nervously. We need to finish the third floor before the shift change. Dr. Peterson and Dr. Harrison exchanged a look that Maya didn't like. As they walked away, she heard Dr. Peterson say, We need to deal with this problem before it gets out of hand. That evening, Maya sat in her apartment reviewing everything that had happened. The patient incident had forced her concerns into the open, but it had also made her a target. She realized that her position was becoming more precarious by the day. She also realized that she had learned everything she needed to know about the hospital's culture and problems. The question now was whether to reveal her true identity and use her authority to force changes, or to continue gathering evidence that could support more comprehensive reforms. Maya looked at her notebooks filled with detailed observations and her folders full of documentation. She had enough evidence to transform the hospital's operations completely, but she also knew that the resistance to change would be fierce, especially from people like Dr. Peterson who saw any challenge to their authority as a personal threat. Tomorrow would bring new challenges, and Maya sensed that her time as an undercover cleaner was coming to an end. The real work of fixing the hospital's problems was about to begin. Maya arrived at work the next morning, knowing it would be her last day as a cleaner. The patient from room 218 had taken a turn for the worse during the night, and the hospital administration was scrambling to understand what had gone wrong. More importantly, her father was scheduled to arrive at 10 a.m. for his quarterly inspection of hospital operations. She went through her morning routine one last time, changing into her uniform, gathering her cleaning supplies and checking in with Dorothy. But today felt different. Today she would finally be able to use her real voice to address the problems she'd been documenting. You seem different this morning, Dorothy observed as they prepared their carts. More focused, like you're planning something. Maya smiled at the older woman who had become such an important mentor. I am planning something, and I think you're going to be surprised by what happens today. At 9:45 a.m., Maya excused herself from her cleaning duties and made her way to the employee locker room. From her bag, she pulled out a professional navy blue suit, a crisp white blouse, and leather shoes that cost more than most hospital workers made in a week. She carefully removed her name tag and cleaning uniform, transforming herself back into the accomplished business executive she really was. Looking at herself in the mirror, Maya took a deep breath. In a few minutes, she would walk into the main conference room and reveal her true identity to the hospital staff who had spent weeks dismissing and humiliating her. At exactly 10 a.m., Maya walked into the hospital's main lobby where her father, Robert Johnson, was waiting with the board of directors and senior administrators. Dr. Martinez was there along with Dr. Peterson, Dr. Williams, and several other department heads who had treated Maya so poorly over the past month. Good morning, Dad, Maya said, stepping forward to greet her father with a professional handshake. The reaction was immediate and dramatic. Dr. Peterson's face went completely white as he recognized the woman he had threatened just 24 hours earlier. Dr. Harrison, who was standing nearby, looked like he might faint. Several nurses and administrators who had witnessed Maya being humiliated over the past weeks stared in shock. Ladies and gentlemen, Robert Johnson announced to the group, I'd like you to meet my daughter, Maya Johnson. She's just completed a month-long assessment of our hospital operations, and I believe she has some important findings to share with us. Dr. Williams was the first to recover from the shock. Mr. Johnson, I don't understand. This woman has been working as a cleaner. Surely there's been some mistake? No mistake, Maya replied calmly. I've been working as a member of your environmental services team for the past 4 weeks. It's been very educational. Maya opened her briefcase and pulled out several folders thick with documentation. During my time here, I've observed and documented numerous issues that affect both patient safety and employee morale. I think it would be helpful to discuss these findings in the conference room. The group moved to the large conference room on the second floor. Maya noticed that several of the doctors and nurses who had treated her poorly were whispering urgently among themselves, clearly trying to remember exactly what they had said and done over the past month. Before we begin, Maya announced, I'd like to invite some additional people to join us. The issues I'll be discussing affect the entire hospital community, and I think it's important that all voices be heard. She walked to the door and gestured for Dorothy, Carlos, and Janet to enter. The 3 cleaning staff members looked nervous but determined as they took seats at the large conference table, probably the first time in their careers that they had been invited to participate in a high-level hospital meeting. Now then, Maya began, opening her first folder. Let me start with patient safety concerns. Over the past month, I documented 47 specific incidents where established safety protocols were not followed. These violations ranged from improper sterilization procedures to contaminated equipment being used in patient care. She projected detailed notes onto the conference room screen, showing dates, times, locations, and photographic evidence of each violation. The silence in the room was deafening as hospital administrators realized the scope of the problems Maya had uncovered. In each case, Maya continued, I attempted to report these concerns through normal channels. In each case, my reports were dismissed or ignored because they came from someone wearing a cleaning uniform. Dr. Peterson shifted uncomfortably in his chair. Now wait a minute. You can't expect medical professionals to take safety advice from cleaning staff. We have protocols and hierarchies for good reasons. Maya fixed him with a steady gaze. Dr. Peterson, yesterday you told me that I was easily replaceable and that my concerns didn't matter because I was just a cleaner. You also threatened my job if I continued to report safety violations. Would you like to explain to the board why you felt that patient safety concerns should be ignored, based on the job title of the person reporting them? Dr. Peterson's face flushed red, but he remained silent. Maya continued her presentation, detailing incident after incident, where valuable safety information had been dismissed simply because it came from support staff. She showed how this breakdown in communication had contributed directly to the patient infection that was currently being investigated. The patient in room 218 developed a serious post-operative infection, Maya explained. 3 weeks ago, I documented and attempted to report specific sterilization protocol violations in that exact room. My concerns were dismissed by Dr. Harrison, who told me that medical procedures were above my pay grade and that I should leave the thinking to people who actually went to medical school. Dr. Harrison looked like he wanted to disappear into his chair. But patient safety is only part of the problem, Maya continued. Over the past month, I've also documented a systematic pattern of workplace harassment and discrimination directed at support staff. She shared examples of the verbal abuse, deliberate humiliation, and professional threats that she and other cleaning staff had endured. The board members looked increasingly uncomfortable as Maya described behavior that could expose the hospital to serious legal liability. Dorothy, Maya said, turning to the older woman, would you please tell the board about your experience trying to report safety concerns over the past year? Dorothy stood up slowly, clearly nervous about speaking to such a high-level group. Well, she began quietly, I've tried many times to report problems I see during my work. Broken equipment, safety hazards, things that could hurt patients or staff, but mostly people act like I'm bothering them when I try to speak up. Maya encouraged Carlos and Janet to share their experiences as well. As the 3 support staff members told their stories, it became clear that the hospital was essentially operating with a massive communication breakdown that put everyone at risk. The solution, Maya announced, is not complicated, but it will require a fundamental change in hospital culture. We need to establish clear channels for safety reporting that don't depend on job titles or hierarchy. We need mandatory training for all staff on respectful workplace communication, and we need accountability measures that ensure patient safety concerns are taken seriously, regardless of who reports them. Robert Johnson spoke for the first time since the meeting began. Maya, what do you recommend as immediate next steps? First, Dr. Peterson and Dr. Harrison should be suspended pending a full investigation of their handling of safety reports and their treatment of staff. Second, we need to implement an anonymous safety reporting system that bypasses departmental hierarchies. Third, we need to establish a patient safety committee that includes representatives from all hospital departments, including environmental services. Maya paused and looked around the room. And finally, we need to acknowledge that every person who works in this hospital plays a vital role in patient care. The people who clean the rooms, maintain the equipment, and support daily operations aren't just easily replaceable workers. They're essential members of the healthcare team whose insights and observations can save lives. The meeting continued for another 2 hours as Maya outlined a comprehensive plan for cultural and operational changes. By the end, it was clear that the hospital would look very different in the coming months. As the meeting concluded and people began to file out, Dr. Martinez approached Maya. "I owe you an apology," she said quietly. "Your interview yesterday was eye-opening, but I had no idea of the scope of these problems. Thank you for having the courage to document everything so thoroughly." Maya shook her hand. The courage came from people like Dorothy, Carlos, and Janet, who kept trying to speak up even when no one would listen. I just had the privilege of being in a position where I could finally make sure their voices were heard. 3 months later, Maya officially joined the hospital as Director of Operations. The changes she had recommended were being implemented systematically, and patient safety scores had already begun to improve. More importantly, the hospital had become a place where every employee's contribution was valued and respected. Dorothy was promoted to lead the new Patient Safety Committee. Carlos became the supervisor for environmental services, and Janet was selected to head the hospital's employee wellness program. Maya often reflected on her father's advice about seeing organizations from every angle. She had learned that true leadership meant understanding not just what was happening in boardrooms and executive offices, but what was happening in every hallway, every room, and every corner of the organization. Most importantly, she had learned that the people who seemed least powerful often had the most important things to say, if only someone was willing to listen.